Botoxing Riz, one of the other doctors today, since he did the same for me yesterday. So today's payback. And if you remember from yesterday, well, I got told to go to work, so this is me going back to work. We're going to give Riz a little bit of a wipe. So,
wash my hair.
Oh right, yeah, sorry. And your eyebrows. You've just drawn them on. This is what I've learned being in the aesthetic profession. You need to be very careful that you don't take people's eyebrows off. It takes ages to put them back on, apparently. So Riz, who already looks about 15, give or take a couple of years, has opted for some Botox for the first time. No, not the first time, and a lot of people looking at him will think he looks young enough anyway, minus from there upwards. And we're going to mark him up, so frown for me. And he doesn't have as much of a frown as me, so obviously he's got a bit more of a easy life. Don't want to give you an eyebrow lift. You might like that. And raise your eyebrows all the way up, all the way up. And Riz is, you can see actually some of the markings in his forehead. He used to have these lines that ran across and they were quite bad. And they've started to come out. You faintly see the faint marks. So raise your eyebrows all the way up. So for Riz, he likes a specific, he likes it done very specifically, so he's already advised me of how he wants it all the way up, all the way up, up, up. Aye. And he doesn't have too much movement left. And this is the first time we're doing his eyes, and he's got all these blood vessels running around his eyes, and you see that one there? So that's the kind of stuff that we want to avoid.
That was where you punched me.
Yeah, well,
when you were kids.
Any more of your cheek, and I'll punch you again. Hope childline are listening. Right, and smile, smile, smile. And you can see the pull of all the muscle fibres, so this is where we're going to go. And you have to be quite close in for the middle spot. And this will diffuse. So a lot of people say, you're not putting it right into my wrinkle. We don't have to put it right into the wrinkle because, smile, because there is about a 1 centimetre diffusion distance at least that you'll find. And relax. And he does have a lot of blood vessels, a little plexus of blood vessels around here. Sod's law dictates I'm going to hit that today, just because I'm on video. So if you've got any questions, feel free to ask. And Nick, you can read them out. So Nicola's behind the camera today.
Hi,
right, so this is a good part of my job. So as Riz said, into the frown you just go in and pretty much you're going full depth for the first wee bit. And half depth really for the corrugators. And these needles are actually the finest needles they make, so this is thinner than a diabetic's needle actually, so you don't actually feel this at all, so don't cry this. And so a lot of people ask, is Botox painful, how long does it take? And to be honest, it really takes seconds, it's not very long. And is it painful? I've never had anyone not come back before because it's too sore. And we do something different here at Westerwood to make sure it's not as painful. So needles is one of them. We use 32 gauge needles, and you see me going back and forth to pick up other needles, and there is a reason for that. If you use the same needle again and again and again, it blunts and it starts to get sore. I'll give you a demonstration of this. No, I won't. Oh. But this will blunt, so it's a good idea to change your needle. So we do have patients who've been before, and you do say, oh, that wasn't as sore this time compared to where I've had it done previously, and it comes down to needles. So that's one of the things. The second thing is use as many needles as possible. So use a small needle, use as many needles as possible. And what you dilute up the Botox with, so a lot of people don't know Botox comes as a powder, it's not a gel, and we need to add some water to it to be able to inject it. So when it comes as a powder, we add some water, and we do keep the water in here. Bottles of water.
It's not tap water?
It's not tap water, no. Definitely not.
Because Ashley thinks you should grow your hair back.
I think he's had it chopped a couple of times.
Yeah. I'm going to keep it like this till the end of summer.
Yeah, I think his hair's longer here now than it is on here, doesn't it?
I do miss it. It's absolutely freezing with short hair.
Well, he used to tie it. He used to have 2 ponytails, so he went from 1 ponytail to 2 ponytails. And And then it went all blonde for a while.
For a week.
For a week. That was interesting. And then he had no hair. So I don't think that was a mistake by Tony and Guy.
No, I asked for it.
No, I know. So it's a mistake going on in his head. So around the eyes, we just need to be careful that we don't hit these blood vessels, to be honest with you. So we try and point away from the centre of the eye. And we have to be very superficial, like Riz was saying yesterday. So superficial as possible. And to be honest, you don't even see any of the... almost can't see where it's been. You see little dots, and this will disappear in about 20 minutes. So that's...
Kerry's asking how long does the Botox last?
So Botox lasts on average about 3-ish months. But you don't get to 2 months and 29 days and wake up the next day and it disappears. You know, you'll get a gradual breakdown. But there's a few things that determine how long you get out your Botox. Firstly, how much you put in. So I'm giving Riz a hefty dose in his forehead, what we call a frozen or a man's dose. Though Riz probably doesn't need the man's dose because he's still 15. But the more you put in, the longer it lasts. It takes your body a bit longer to break the extra bit down. So we charge a bit extra for that, £30 on top of your total bill. But the more you put in, the less movement you have, all the way to no movement. So you need to decide. So you either want it to last as long as possible and you don't care what people think, if they can tell you can't move or not, or you care what people think, you still want a little bit of movement, then you put a little bit less in, and that's how you'll get your 3 months. So some people that are really expressive wear away the Botox quite quickly, expressive people. So if you really move your muscles a lot, so right now the muscles are moving, we're going to relax it out. The more then you move the muscles, the quicker you'll wear it away. So those people that wear it away quite quickly, actors, entertainers, school teachers, those will go gym, salespeople, parents, gym, police folk, really expressive folk, they wear it away quite quickly. So we try and say, listen, resting bitch face is the way you want to go. You don't really want to wear it away quicker. And then the more you get your Botox, so the muscles, after a while, they start to just relax. And the more they stay relaxed, if you stay on top of your Botox, after a while, they develop this habit of just staying relaxed themselves. So you don't need it as often. So you will start to get longer out of it. So probably after 3 or 4 administrations. If you go down the frozen route, you'll get longer than 3 months, usually 4, 5, 6 months. Certainly I do have people who get it once a year. And I do also have men who do weightlifting who come in every 8 weeks. Okay, so giving that away.
Yeah. Is there anything else that you guys would like to see? Lip fillers, nasolabial fillers?
Yeah, I can fill Rizzy's lips today. So if we get enough people that want to see me filling Rizzy's lips, we can do that. And give him some cheekbones. Yep. And anything else that you might want to see, we can probably do that. So, any other questions?
No. Few people said that these are the best doctors ever.
Oh, thank you very much.
Thanks very much. Practice makes perfect.
Leave a review on Facebook for us, thank you.
Yeah, we wouldn't be anything without our patients, so thank you to all our patients and to anyone who's interested.